In this video lecture, we're going to be looking at chapter 22 out of the Modern Dental Assisting book. We're going to go over the post-exposure management. So just a short portion of this chapter, but we're going to talk about what we're going to do if an incident were to happen. So we do have efforts to prevent occupational exposure incidents, but they do happen from time to time in the office. And the BBP standard requires the employer to have a written plan. The plan's going to explain the steps that we're going to take after the exposure happens and the medical follow-up that's provided to the employee at no charge. We're first going to go into this procedure 22.1, and it's going to talk about first aid after the exposure incident. So our goal is to perform the appropriate first aid after the exposure has happened. We're going to have soap and water, paper towels, antiseptic cream or ointment, a bandage, and then our exposure incident report form. When the incident happens, we're going to stop all operations immediately, remove our PPE, wash hands thoroughly using the antimicrobial soap and warm water. We would dry our hands, then apply a small amount of antiseptic to the affected area. We would then apply our bandage and complete the applicable post-exposure follow-up steps. We want to note that we're also going to tell our employer or supervisor about the injury immediately after we finish first aid. So knowing that, we're going to jump back up in the chapter. Let's scroll a little bit here. And we're going to talk about management of an exposure incident. So we're going to document the routes of exposure and the circumstances in which the incident occurred. We will identify and document the source of the individual, so the patient, and then request that that patient get their blood tested. Also, the employee that had the incident get their blood tested. We'll provide medically indicated prophylactic treatment like necessary injections, provide appropriate counseling, and then evaluate the reported illness after the incident. Follow-up measures for exposed worker are going to include medical counseling, HIV test series 6, 12, and 6 months after, hepatitis B virus, a booster of tetanus, and then documentation of incident on appropriate occupational safety and health administration form. The BBP standard requires that the dentist or employer provide training in infection control procedures and safety issues to all the personnel who come in contact with blood, saliva, or contaminated instruments or surfaces. We have to keep record of these training sessions, and it should include the date of the session, the name of the presenter, the topic, and the names of all the employees who are in attendance. Hepatitis B immunization. So the BBP standard requires that the dentist or employer offer the HPV vaccine series to all employees whose jobs are in that category 1 or 2 tasks. It should be offered within 10 days of assignment to the category 1 or 2 job. Post-vaccine testing between 1 and 2 months after the series has been completed. A blood test should be performed to ensure that the individual has developed immunity. The dentist and employer must keep a confidential medical record for each employee. The employer must store these records in the log file for the duration plus 30 years after. In the medical record, we should have the employee's name and social security number, proof of the employee's hepatitis B virus vaccine or a signed refusal, circumstances of any exposure incident, copy of post-exposure follow-up procedures, and the records must be retained by the employee for the duration of employment again and 30 years.